Welcome to this week's edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features various presentations on opioid use, medication management, recovery, and overall health. Senior Talks is sponsored by Harris County Area Agency on Aging and the Council on Recovery's Elderly Program. Today we have with us Rosanna Ishee, Older Adult Specialist for the Elderly Program. Today, Rosanna will be sharing with us some information regarding medication-assisted treatment in older adults. All right, Rosanna, take it away.
Thank you. And again, thank you all for joining us. My name is Rosanna Ishee. I'm the Older Adult Specialist with the Elderly Program at the Council on Recovery. And today's presentation is medication-assisted treatment in older adults. You'll also hear medication-assisted treatment referred to as MAT. We're going to talk about medication-assisted treatment with regards to opioid use disorder and alcohol use disorder. So I want to talk about opioid and alcohol use disorders as a public health concern. Alcohol and other drug-related conditions are the #1 public health concern in the United States, and unintentional overdose is the leading cause of accidental death. Also, illicit drug addiction and alcohol addiction are among the most stigmatized social problems. Then you have the public health concern of punitive judgment, incarceration versus treatment. For example, it adds to the ever-increasing problem of our already overcrowded prison and jail cells. Then you have the increased spread of infectious diseases, including HIV and hepatitis C. Also, the aging baby boomer population has higher rates of substance use than previous cohorts, which of course places an increased demand on substance abuse treatment services. There's also limited research on older adults with illicit drug misuse, and on an average day, a study showed that older adults, there were 29 admissions to treatment for alcohol use and 6 admissions to treatment for heroin or opioid use, and this was just an average day. And what I'm going to put up on the screen right now is an opioid epidemic by the numbers. And it's some important data that I want to share with you. And just looking at it at a glance, you can see that the numbers are very significant. I'm not going to go over each of them, but just even looking at it at a glance, for example, 2.1 million people had an opioid use disorder. 130 plus people died every day from opioid-related drug overdoses. And let's just pick another number. 2 million people misused prescription opioids for the first time. And then a little over 42,000 people died from overdosing on opioids. And as you can see there, the numbers are rather staggering, and which is why this opioid epidemic is really taking us all for a loop here. So we're going to go ahead and go straight into our medication-assisted treatment. And just to tell you what it is, like just a brief definition, it involves the use of FDA-approved medications, and in combination with counseling and behavioral therapies, MAT provides a whole patient approach in the treatment of substance use disorders. Some of the benefits of medication-assisted treatment is combining therapy with medication can be successful in the treatment of substance use disorders. It can be used in the treatment of opioid addiction, including prescription opiates, such as pain relievers. And MAT is also used for those struggling with alcohol use disorders, and it can help those struggling with addiction to sustain their recovery. So, MAT for opioid use disorder The FDA-approved medications include methadone, buprenorphine, and naltrexone. These are medications used to address addiction to codeine, heroin, and morphine, referred to as short-acting opioids. And MAT medications also treat the misuse of semi-synthetic opioids such as oxycodone and hydrocodone. Many individuals have safely used these medications over time, ranging from a few months, years, to a lifetime. So one of the FDA-approved medications is methadone, which reduces opioid craving and withdrawal, and it blunts or blocks the effects of opioids. Methadone is taken once a day, and it's available in various forms such as liquid, powder, tablets, and diskettes. And you'll also hear it referred to as methadone maintenance therapy. Another FDA-approved medication is buprenorphine. And unlike methadone treatment, which must be performed in a highly structured clinic, buprenorphine is the first medication to treat opioid dependency that is permitted to be prescribed or dispensed in physician offices. Then you have naltrexone, which comes in a pill form or an injectable. And this works by blocking the euphoric and sedative effects. And it works differently than buprenorphine and methadone, which activate opioid receptors in the body that suppress the cravings. Naltrexone binds and blocks opioid receptors, reducing opioid cravings. And if a person relapses and uses, naltrexone will prevent the feeling of getting high. Increasingly important is the use of naloxone in efforts to combat opioid overdose and death. And we have also provided information on our talks regarding naloxone, also known as Narcan. But again, just to reiterate that it's a medication called an opioid antagonist, and it has no potential for abuse, and it counters the effects of opioid overdose, for example, morphine and heroin overdose. And it does that by counteracting life-threatening depression of the central nervous system and respiratory system. And an overdose victim can then breathe normally. Narcan is usually administered by emergency response personnel. However, it can also be administered by minimally trained lay people. And increasing access to these and other medications and services is critical to reducing opioid misuse and decreasing the opioid overdose epidemic. Now we're going to talk about medication assisted treatment specific to alcohol use disorders. So let's just talk about the general facts regarding alcohol use. For example, 18 million met the criteria for alcohol dependence or abuse, yet only 1.4 million received any specialized treatment. And diagnosis of an alcohol use disorder continues to present significant social exclusion. And social exclusion continues due to a lack of understanding that alcohol use is a treatable medical disorder. Those 65 years or older are more sensitive to the effects of alcohol due to changes related to normal aging process, such as metabolism, fatty tissue, etc. And substance use and misuse, such as alcohol, presents itself with significant problems in the older adult community. It's also a medical and social crisis. Many older adults with an alcohol use disorder have health and social problems, which can increase their risk of nursing home placement, hospitalization, and even death. Those ages 50 and older with a substance use disorder is projected to be over 5 million by the end of this year. And most substance use admissions for people aged 65 or older were primarily for alcohol. So some of the challenges facing the older adult population in being properly diagnosed with alcohol use disorder include misdiagnosis by healthcare providers, shame and denial, minimizing or ignoring the problem, and equitable access to adequate treatment. These are just some of the challenges. So some of the medications approved by the Food and Drug Administration used to treat alcohol use disorders within MAT are Disulfiram, Camprozate, and Naloxone. These medications address alcohol use disorder, but while none of these medications provide a cure, they are most effective for the individuals who participate in an MAT program. And again, as mentioned earlier, many individuals have safely used these medications over certain lengths of time successfully. So Disulfiram is one of the FDA-approved medications, and it's most effective in people who have already gone through detox or in initial stage of abstinence. It's offered in tablet form, taken once a day, and Disulfiram should never be taken while intoxicated and should not be taken for at least 12 hours after drinking alcohol. Disulfiram is also known as antabuse. The next FDA-approved medication is Camprozate. This is for people who are in recovery, who have already stopped drinking alcohol and want to avoid drinking. It works to prevent people from drinking alcohol, but it does not prevent withdrawal symptoms after people drink alcohol. Then you also have Naloxone used as a treatment for alcohol dependency. Naloxone blocks the euphoric effects and feelings of intoxication, but it does allow people with alcohol addiction to reduce their drinking behaviors enough to remain motivated, to stay in treatment, avoid relapses, and take medications. And just one more thing I want to say regarding alcohol use disorders in older adults. There was an important study that was done over a 7-year span. It was a national survey, and it showed that on an average day, 6 million older adults drank alcohol, that's a significant amount of, that's significant numbers. And so although MAT can be successful in helping individuals sustain recovery, there are challenges to overcome. For example, one size fits all does not apply when it comes to treatment for addiction. Attending group therapy with younger adults can be uncomfortable for older adults, and many older adults have medical comorbidities. For example, they may be using opioids to treat chronic pain. Many have liver issues, diabetes, high or low blood pressure issues, viral hepatitis. And also many older adults with an opioid use disorder or alcohol use disorder may have medical problems that have impacted their quality of life, and they're using opioids and alcohol as a way to manage their pain and suffering. And again, older adults do well with elder-specific groups. Another challenge in the older adult community is some may be feeling a loss of purpose and meaning. Many have a history of childhood trauma, and many feel alone. But there are some solutions, such as providing group sessions specific to older adult age groups, having that safe space to have conversation with their peers in similar situations is very important. And professionals trained in geriatric substance use disorders is very helpful. And then offering accessibility for older adults, such as wheelchair ramps, printed materials in large print, speaking loudly and slowly for those who may have hearing problems. Also, programs and therapies such as medication-assisted treatment, which may help instill a sense of hope or self-efficacy and sustain recovery. Also, many of the older adult community may need assistance with stable housing, definitely listening and understanding with empathy and compassion, Again, equitable access to health care, equal access for all. And of course, joining others in the fight against stigma. So this is the conclusion of my presentation. Again, I thank you for joining us with our senior talks. The numbers and the information that's showing on the screen, we encourage you to reach out. And let me remind you that we're currently in collaboration with the Harris County Area Agency on Aging. We're doing a medication management reconciliation program, free and confidential. And so we encourage you to call us, and we'll be more than happy to walk you through it. We'll do it with you over the phone, and it's a very important program as a safety strategy. So again, we thank you so much for joining us, and we'll see you soon. Thank you.